Good afternoon, everybody. Uh, it's a great pleasure that we have such esteemed guests here, and probably it is because Veloxx Media has taken an initiative in Uttarakhand that they have come forward with giving a platform to us to interact with each other. And since morning, we have had probably very mind-throbbing sessions, and we have had presentation from Prashant, Dr. Prashant from BMJ, and Dr. Arun, Shiva from the uh, Apulki hospitals, Apulki group, and we have Dr. Akash Gand, Dr. Satyapalli, and Praveen Bishji. Thank you so much for being here with us. And the topic has been PPP and innovations. PPP is a very important topic, public-private partnership. Uh, why public-private partnership is required in the health sector? Probably the reasons are varied. The main reason is that everybody does not um, suffice all the requirements that is required to provide healthcare service anywhere, whether in the hospital or elsewhere or within the government. Probably to begin with, I was told to put up some certain questions, but I don't think so. Questions are more important. The importance is that I would like to know from probably from Dr. Arun regarding what models does he foresee in public health private partnership with the government, because the moment the word public health private partnership comes, the terminology refers to government sector and the private sector. The second most important is how do we sustain these projects, and not only sustenance, how do we govern these projects, how do we move ahead, what could be the financial resources which are required to manage these projects, and in which sector should we go ahead in uh, ensuring that we are able to provide the healthcare services and achieve certain targets which are set in to like for the basically what is required is where public health private people come and join the public sector, that is the government sector. The basic important factor is the patient outcomes and the operational efficiency that we need to achieve. So I would request Dr. Arun Shiva to just
Thank you.
give his insight on it.
Uh, so where I look at this is that we are discussing about PPP models, and we are aware that the power that the government has actually, and the power that the public sector has, when it comes together, actually, it's going to add a lot of value. We want to create sustainable models. We are looking at, we have been discussing for so many years, and we have drafted so good policies. The thing is that we should be looking into a larger perspective now. Okay. It's not simply about just a financial viability. Both partners should look at the outcomes. What are we trying to achieve here, actually? Are we, why we are trying to create this? With this power, currently we have been discussing from morning, we have been discussing about how to create access to the interiors and what kind of outcome. We have been discussing, I still remember 21 years ago, I was working in, I was with government, with public funded institutions. We were discussing like we are treating so many number of patients actually. So I'm from oncology, so we used to say we treat so many cancer patients. And today we are saying that, okay, we are treating so many and we want to treat. No, the lookout for the outcome has to change. What we have to look for is that how much is the 5-year survival now of a cancer patient? Okay. So when we look at a model actually, so we should be looking at the outcomes of how much we can achieve from that. Based on that, we have to see that कि मतलब how the financial viability can be achieved from that actually. So our end point should be like what we are achieving. If we are creating a PPP model, okay, how much of the incidence of any disease has reduced in that region? And how much of the improvement has come up in the aspirational districts, maybe. So we have to look in a complete lookout rather than just looking at, okay, I have done so many number of cases. My work is done. No. So like for one example would be like how many patients are coming on a repeated basis. They shouldn't come. Okay. So at that point, this kind of a PPP model will create a quality of service. That's where the quality will come, when the number of repeated visits are reduced, when the number of incidents are done with our preventive checkups. If camps are gone, how many repeated checkups are done? Where the camps had not been any use for the general public. So if we look at that point, actually, and then we from that, when the quality of care arrives, actually, by default, the financial viability will fall into picture. So that is the most important thing. We should be looking at the outcomes, what we are trying to achieve. Both the partners in this, actually, both the government and the private party, both have to understand that what we are trying to achieve.
But you mean to suggest that the projects which we decide should have a sustainable model and should be for longer period of time to achieve the financial viability as well as to achieve the outcomes wherein the patient in the longer run get benefit.
Yeah, with the utmost quality.
And we fulfill the objective of providing better healthcare services.
Definitely.
Thank you so much. Dr. Akash Ken is also doing part of public-private partnership, but he's into private-private partnership. So he's running a cancer oncology center in Kailash hospital. So, sir, how do you think that digital transformation and cancer oncology could be related? How do you feel that these things could be added on and we can go ahead and we can have a better outcome and outputs in the longer run?
Thank you very much, Dr. Tuhin. And I had the great pleasure of meeting you in the hospital itself. And first of all, my congratulations to the Veloxx for organizing such a good program. And this is a very pertinent platform here that we are sitting. And I totally agree with Dr. Arun. And we are from the same side, both are in oncology. So you can extrapolate what we say about oncology to other diseases also. Now, as Dr. Tuhin very rightly put it, I am in Kailash Omega Cancer Center. It is not a PPP model, but within the private, it is another company which is taking over, right? So this very thought, in private itself, we didn't have enough partners here, right? So if you look at the geography of Uttarakhand, and I'm from Bangalore, I'm from South, and I think even you're from Kerala. I mean, we are from South. In North India, everybody below Bombay is from South, and most of them are from Madrasis, they say. But anyway, jokes apart, what I'm trying to say is, in the topography of Uttarakhand, there are 13 districts. And it is divided into Garhwal and it is divided into Kumaon, right? So, And we have, I think, 3 government hospitals, and we have some, I think, 5 government hospitals.
No, 13 district hospitals. We have 21 SDH
Yeah.
and around 79 CSCs.
Yeah.
The 81 CSC
Yeah.
and 576 primary health centers.
So with this, I mean, thank you, madam, and Dr. Tuhin to share that information with me. But despite so many hospitals, we are not able to percolate down. I'm talking again of cancer, because please extrapolate that to other diseases, diabetes and everything. We're not able to percolate the healthcare system down to that level. In spite of so many medical colleges, none of the medical colleges are, except for Sushila Tiwari, has a radiation machine. There are only 3 radiation machines in whole of Uttarakhand. One is with Rishikesh AIMS. Other one is with Himalayan Hospital, where I also worked for 4 years. And the next one we have put, we are Omega Cancer Hospital. We are in coordination with Kailash Hospital. In Kailash Hospital, we have taken over outsourced the cancer center. So there are only 3 machines in the whole state. There are only 2 PET scans. Now, if you look at Kerala, I'm sure, and I'm from Bangalore, every locality has a PET scan. Every locality has a PET scan. Every locality has a big hospital which is serving radiation, and they're serving basically cancer. But in a state like Uttarakhand, with such population and so many districts, we have very few facilities percolating down to that level. Even in private, we don't have that much. Now, if you consider like Max Hospital is a big name, right? Max Hospital is a big chain of hospitals. They don't have a complete comprehensive cancer unit. They are sending their radiation patients to us because there are only 3 machines in the whole state. So we need to, now coming back to the, now we have discussed about the logistics. So whenever there is I always, as a surgeon, I'm a cancer surgeon, I always think whenever there's a problem, there's a big potential also. So there's a big potential to develop this area. And Dr. Tuhin has, unfortunately, we met in a situation where, we were dealing with a patient, his patient, but we couldn't talk further. There's a big shortage of, tertiary care system in Uttarakhand. So what I feel is in PPP mode, if we can bridge this gap. Now, I had also inspection in the hospital, in my hospital, so I came late. But whatever little I heard, the previous panel discussion, there are very few doctors who want to go down to the hills, right? And for obvious reasons, many of the doctors also said, Dr. Anuj was here, he said, all those things. So if we have a PPP mode, can we bridge that gap? I mean, we provide you, skills. We are talking about skill set. So we are the people, if we partner with the government, we provide you the skill, skill sets, and you provide us the infrastructure. In the sense, what I read in community medicine, I mean, very little I remember now of that because it was way back. So you have a PHC, which is at the grassroots level, at the village level. Then you have a CHC. Then you have district hospitals. Then you have main hospitals. So you have your people, doctors and paramedicals, right in the village. So if we can use this networking, because already your people are there in these areas, they are there in the villages, they are there in the district hospitals. We need to just buffer them. We need to give our skill sets. And as Dr. Tuhin rightly said, now with AI and technology. Now, if you ask me, and I was offered to go to, I don't remember, Satpuli. I was asked to go to Satpuli. They were opening a cancer hospital there. They were thinking of opening a cancer. I don't have to be physically there all the time. In Satpuli, in the hills, I can, if I use the technology in the right way, you have telemedicine, everything is discussed, you send me the reports, because the logistics of me staying in Satpuli is just an example, by the way. And staying with my family, with my kids' education, my small children's education is quite a task. But if we use a PPP mode and telecommunication, and we're talking about AI, all the information, and we use your network at the PHC level, at the CHC level, at the district hospital, you already have people there. We need to just buffer that. You give us all the information, as a patient, we can also have a video talk with your patient. Isko ye problem hai, you get this thing done. They can go to the next stage, where district hospital, get a CT scan done, everything. I get all the information. And then I advise them. Or if required, even go and meet that person after getting all this information. So what I'm trying to say is you have a beautiful, when we used to read community medicine and it is in place, you have a beautiful networking system. Your people are already there. We need to just collaborate with you and use your system to render the medical care at that level, at the grassroots level. That's what I think should be done. And that's where PPP mode should come into this being. And that's where your technology also will be used. The telemedicine, the CT scans can be downloaded on your laptop. Everything will be there. So once you collect the data and then you can address those issues. And if required, my team can go there. But for me, to keep my whole team in a place in Almoda is logistically very difficult to stay in Almoda with my whole team. But I collect all the information and I send my team if it has to be operated in the district hospital. We upgrade that is where the PPP mode will come. We upgrade your district hospital to do a high funda surgical maneuver, a very high-end surgery. We do in your district hospital along with you. We upgrade that with your thing, and we use your system, AI, your networking, AI, and our skill sets, and I think that's the way to go forward.
That's more like doing an hub and spoke model.
Absolutely.
It's like we are doing a lot of telemedicine. We have done quite a bit from Uttarakhand Health Systems Development Project, which was sponsored by World Bank, where we have around 400 PSCs where we are providing telemedicine services and the hubs being the medical colleges.
Right.
Probably that is what Rajesh sir in the morning also said, was informing about that. And I do agree with you that we can utilize our resources which are there, very well there. But at the present moment, what is happening is that we are doing a lot of work in the field, but we are doing in tits and bits. Like we are trying to do some NCT screening work, which includes cardiac assessment by doing blood pressure monitoring, diabetes, all these things we are doing. But it needs to be a collaborative effort. Like we have a lot of portals, but these portals are not collaborated. We don't have a common platform where we can see these portal with a single eye. We need to enter for every portal we have a link. We have to enter there and then we can have an access to that portal. But probably what I feel is digital transformation is related to the fact where everything needs to be on a single screen. It should be available. Yeah. Secondly, the most important thing is we need to identify the gaps where we want to work and move ahead. At least in PPP projects, what I feel is that the forte of government is public health. Public health is limited to secondary care. When we talk about tertiary care with cardiology, nephrology, neurology, oncology, these subjects are related. There we need an intervention where the private partners can come in, intervene, and we can move ahead jointly and achieve the targets set as ahead of us and achieve whatever the important goals are.
Dr. Tuhin, I'll just take one more minute.
Yes.
I mean, just continuing from where you're mentioning. Now, if you see this time's the budget which came out this year, And there was also one statement which was very, because I'm an oncologist, I grasped that. They are planning to have in every district hospital a chemotherapy ward, right? It was announced during the budget this time that every district hospital of the country should have a chemo ward and chemo should be given there, right? One point is that. Point number two is your tertiary care center, the medical colleges, also need to be, we had a discussion on breast cancer once, and you were also a part of that meeting, where you did screening for breast cancer using some device. Yeah? We taught the Anganwadi workers, screening, this, that, everything at that grassroots level. Now, that grassroots level diagnosed a case of cancer. Once you've diagnosed the case of cancer, then next what? You're diagnosed, goes to tertiary center. Most of your I'm sorry to say, with all modesty, most of your tertiary care centers, and I'm talking about cancer, do not have that facility. So the talk was, even if you have diagnosed at the grassroots level, where do you send the patient? Then the talk was whether we equip the government tertiary care system, like the medical colleges, or you can also partner with some private. So that's what was the last time discussion. So again, that if we do some programs where you had non-communicable thing, you have diagnosed something, then what?
Yeah.
Just one sentence to this. So I was talking about the hub and spoke model actually that we are creating actually. Sir had a wonderful suggestion that we create the hub actually, and the spokes are already available with the public actually. So we just utilize the spokes actually. So there are different models actually, but thing is, the both partners actually should not come and say that, oh, this is mine, I'm not sharing it. So we have to start thinking it's our people that we are trying to save. So once that communication gap is bridged, then everything will come through.
Thank you. We have been in the morning, just pre-session also, we were discussing about the skill sets of the doctors. Hello. And apart from that, apart from the skill sets, we were discussing that the medical education which we at the present moment are giving, there is a big gap, and the doctors, probably the new doctors which are coming up, they are focused towards doing post-graduation. And many of the doctors don't want to go into the field where they can give their services and stay back, and there is a lot of attrition also because they don't want to stay there. So Dr. Prashant Mishra is here from British Medical Journal. How do you want to, or how would you like to address this issue? Could you just elaborate upon this?
Let me.
And using also the concept of digital transformation. Digital transformation is nothing but it includes AI and other health management information systems and portals on a single platform. That is what I feel is the right way of moving ahead.
So Dr. Tuhin, thank you. From my entire experience of being working with the governments, whether at the federal level or whether at the state level, and also with the medical institutions, one thing which is very clear to me when we discuss this topic of digital transformation in the healthcare, many a times we tend to focus or rely too much on the technology part, right? Which absolutely is a must, right? But then, having said this, our experience shows that when technology is integrated with the knowledge, because that's where we coming from, right? As BMJ, we provide very high quality evidence-based medical information. The moment you actually integrate that knowledge base with the technology, we've seen that the healthcare improvements, whether it is the diagnosis, whether it is the treatment, and ultimately whether it is the patient outcome, that's what we are really caring for. So that seems to increase, right? So that's one part of it. The other is, I'm just reflecting back on what was being said by Dr. Kapoor in the post-lunch session. He made a remark. He said, how do I ensure, I mean, he obviously talked about quantity versus quality debate, which has been there and would remain so, considering the size of our country. I think it's also about the quality. The day the MBBS student comes out of the MBBS, the medical college, how do they really ensure that they are keeping themselves abreast, up to date with the latest knowledge? And this is medical science where we know the knowledge doubles almost every 5 years. It's very fast. So the point is, how do you ensure that a doctor or a nurse who's manning, say, a primary healthcare center or a community health center, she's at least well equipped. She may not have the best of the infrastructure, but at least from the knowledge perspective, she knows that I can manage, largely I can manage the patient, right? So that's where I think the role we play to really empower that healthcare workforce in the public healthcare sector. It's part of human capital development, if I may say so. Technology, yes, because most of the things are now digital, including our knowledge that we share. And so that's my take, right? Integration of technology, not just technology alone, it's with the evidence-based knowledge, which really would lead to better patient outcomes. Thank you so much.
Mr. Satya, what you would like to, how do you foresee public-private partnership in relation to digital transformation, and what are the key factors which you feel that would enable a good relationship, building up of a good relationship between the private sector and the government sector? Again, I would put it this way: achieving the target, and the basic target is to provide the best and the best possible health care services in, at least in Uttarakhand.
Yeah, thanks for Veloxx Media for giving this opportunity, and I am honored here to share my thoughts. So, well, so here we have 1.4 billion population, and every year on year with the rising number of chronic conditions and rising number of non-communicable diseases and infectious diseases. So far, maybe 5 to 6% of populations which are at high, very severe conditions. But when in the next decade, if we forecast, at least a 30 to 40% of population in India will going to have at least a one chronic condition they are struggling with. So the technology is a barrier which bridges the gap between care delivery and the payments, and which enables true care, personalized and evidence-based care that doctors are mentioning. So now technology is not limited by itself, which is so advanced in such a way that it can even track the root, genetic insights can be integrated, and all patient 360-degree data can be integrated and personalized and contextualized to present to the doctors in well-processed way. Because a medical data, when we say data, data again, which plays major role in digital transformation because it is a backbone of the health. So the healthcare has all types of data, okay, which has images, which has waveforms, which has a transactional data, which has several other data. But processing the data and transforming data and aggregating and presenting meaningful insights, either to do the population health analytics or cohort of disease analytics, or even to do the disease progression models. The technology has all the capability to do that. But only thing is the private sector and doctors should come together to adopt these technologies, because data at the end, the data plays a key role in transforming the healthcare by itself. So for example, the preventive care. When we talk about the preventive care, there are a lot of, the genetic labs which are setting up across the lab, and which gives very good insights of the disease predispositions. So if I know that my body has a tendency to develop certain conditions, then I can take the preventive steps to avoid it, either to postpone it or to completely stop it. And also there are nutrogenomics, pharmacogenomics, and many more advanced level of genomic labs are coming, and the technology, data, infrastructure, everything should be collaborated together to, deliver the care. When you say it is a key metrics that we need to measure is the government should work on making healthcare is more accessible and affordable. At the same time, the private sector has to work towards the innovations and profitability. So these metrics will help really to transform the healthcare. That's what I feel. Thank you.
I don't know why. I think so. You should talk about the policy also, because government has to relax its policies and moving ahead in PPP mode. CS ma'am is here, and with due regards, ma'am, there is a. I would just request Mr. Praveen. Mr. Praveen, in 2007, I visited Amrita Hospital at Bangalore. That was long back, and Kochi, yeah. So that was big regarding telemedicine and other services. And then I've been trying to communicate in the last 1 year. It's an opportunity that you're here today. And thanks to Veloxx once again for this. How do you foresee public-private partnership in the health sector, and how do you foresee that we can achieve our targets, and we can do something which is achievable, and the knowledge which the private sector has, it can combine with the knowledge of the government sector, and we can at least bud a good sapling there.
Sure.
How do we build that sapling? Thank you.
Thank you. Thank you again. Being the last person here, I'll try to keep it very short, hopefully sweet also. So coming to the public-private partnership, as you rightly mentioned, it's the strength that we need to acknowledge. Public sector has its own strength, private sector has its own strength. So we need to acknowledge each other's strength, and just like any other partnership, in this partnership also we need to build trust, right? Unless there is trust, the partner is bound to fail. So how can that trust be developed? Trust can be developed ensuring you have data seamlessly integrated together. It should be able to be exchanged freely, but in very secure fashion. Unless it is secure, we know data now being cyber security being such a threat, it can very easily get into wrong hands. It can be abused. We can try to put it in a dashboard and try to utilize it, but if it goes to wrong hand, it can be misused also. So the trust factor is very, very important. Data interoperability is very, very important, because it has to be all standard driven. Until it is standard driven, the two partners cannot talk to each other, and unless there is a language common language that binds the two partners, the partnership cannot be fulfilled. So I think these are some of the fundamental things. So digital transformation, yes, it's here to stay. AI is going to be playing a bigger role with the time to come, especially in the state like Uttarakhand, where physical proximity is very, very difficult. But with technology, we can bridge the gap. Technology is there, ubiquitous. It can be available at every point in time at the same instant. So that makes it very, very lucrative, especially for a hilly state like Uttarakhand, and I'm proud to be part of the state. And you are welcome. Now we have opened up a new hospital in Faridabad. It's a 2,600 bedded hospital, one of the largest in Asia.
It's a 2,000 bedded hospital.
2,600
2,600.
Yes.
So one of last year it was 2,000 bedded. I was told like that.
So you're most welcome, and I'll be very happy whatever possible way we can develop this collaboration, and I'll keep it short. Thank you so much.
Thank you so much, and I think a lot of good points have come in, and probably Mohit, we will
If
have
you
a
just,
very soon the coffee table book will be there with ma'am.
Just
Thank you so
one quick point can I make? Now we were also talking, sir has told in such a good way. We have a lot of the district hospitals are getting empowered now. So one request, now if you see a lot of good doctors are there in the private sector. Now, if you see, for example, Dr. Naresh Trihan, he is the best cardiothoracic surgeon in the country, right? He's in a private setup. Now, why don't we allow private doctors to kind of, in the medical colleges, to have an honorary professorship, to mentor the doctors? I mean, just imagine Dr. Naresh Trihan teaching a young faculty in Doon Hospital about cardiothoracic surgery. Can anything get better than that? No. So I think we have to invite the stalwarts who are, I'm not saying I'm a stalwart, but I could also teach. But why not you take the services of these stalwarts who are in private sector, give them an honorary post, honorary professor, let them be mentors to the young doctors. That's what I would, from this bench, I would try to say that.
Thank you, sir. It's a welcome thing. Ma'am will guide us, and it's a great idea, I think. Yes, ma'am. Thank you so much.